So our next speaker is really one of my very favorite people, and we're so lucky to have her here in the Fox Valley. So she is Maren Peterson, Executive Director of the National Alliance of Mental Illness, Fox Valley, where she leads NAMI's education, outreach, and support activities. She is on the board of directors for the League of Women Voters, Appleton, and holds a law degree and certificate in nonprofit management. Prior to returning to her hometown of Appleton and joining NAMI Fox Valley in 2014, she practiced law with a focus on antitrust and trade. So help me give a warm welcome to Maren.
Thank you, Amanda. And you're one of my favorite people in the Fox Valley, too. Let it be said. So one of the things Amanda just mentioned is that my background is as an antitrust lawyer, and that's how I spent the first decade plus of my career. So what that means is I spent that time in the offices of CEOs and salespeople, or sitting at board meetings of large corporations, or counseling clients in other ways and saying, don't you share any information with anybody else in your sector, right? That was my job. And so when I decided that I didn't want to spend the rest of my life practicing law, and kind of thought about what I wanted to do, and ultimately decided that nonprofit administration was what I was interested in, which made sense for a lot of reasons, and I was happy to do it, and I got into it, and I thought, okay, let's go, and everyone said, so what are you doing? What are your numbers? And I thought, whoa, don't you share any information. And so it took me a little bit. But I am happy to say that I am here today to talk about what has become my favorite thing to talk about. And I know you're all a little bit bored. You've been sitting here for like an hour, and you're like, tick-tock. But collaboration is exciting, and collaboration is what makes the Fox Valley and the Fox Valley nonprofit community tick. It's what makes us able to do what we do. I mean, I see a lot of friendly faces out there. I know I have a lot of colleagues out there from other nonprofit agencies, and you know what I'm talking about. If we sit there in silos, we're not going to be able to accomplish anything, right? So this is it. This is what it's all about. So let me tell you a little bit, back up and tell you a little bit about NAMI Fox Valley, because I know a lot of people have heard of NAMI Fox Valley, and you know we're mental health related, but what do we really do, right? I'll tell you what we don't do first, because that's probably the easiest. We do not do any clinical work. We do not have therapists. We do not have psychiatrists, psychologists. We do not provide counseling. We collaborate heavily with those who do and are very, very appreciative of that work, but the niche that we fill is a little bit different. We provide education, we provide support, we provide outreach to try to break down the stigma associated with mental illness, and to make sure that those who are living with mental illness and their families receive the support that they need and receive the connections to resources that will be helpful for them also. So NAMI actually is a grassroots organization. It's the largest grassroots mental health organization in the country. And what that means is it didn't start from the top up. It started from, or the top down, it started from the bottom up. It started by people across the entire country who had family members living with mental illness, starting these quiet conversations with one another, collaborating with one another to form little groups to share education and provide support. And then they realized that was happening all over the country, and they started to connect to one another, and the groups became a little bigger. And ultimately, one of the groups, and it happened to be a group right here in Wisconsin, in Madison, thought, you know, we hear this is going on in other places. Why don't we see if we can learn from these other groups? Why don't we see if we can reach out to other groups across the country and see if any of them would be willing to talk to us? So they put the word out, and they decided they were going to have a meeting in Madison. They were going to have a speaker, and they thought, maybe we'll get, 30, 40 people to attend. We'll learn a little bit, and we can start thinking about what to do. Well, you know what? Over 200 people came from all across the country, from over 70 different communities. And that's when the National Alliance on Mental Illness was formed. So our background and our history stems from sharing information, stems from collaboration. We wouldn't be here without it. NAMI Fox Valley itself was formed in 1981, and was formed as one of the very small NAMIs, as almost all NAMIs are formed. A few very dedicated people meeting in a church. And today, in 2017, which I can't believe it's 2017, but it is, and here we are one of the largest NAMI affiliates in the country. We served over 17,000 community members last year through over 24 programs, including over 27 support group meetings every month, dozens of educational programs ranging from half-day programs on something like crisis de-escalation or a specific topic to 3-month-long programs training people to provide peer support and everything in between. One of the programs that we're most excited about recently, because it's pretty new, is Iris Place Peer Run Respite, which we opened in 2014. Now, Iris Place is a 5-bedroom, it's a house is what we call it, but it's in the old St. Bernadette Convent, so it's pretty large, but we've done our best to make it very homey. And individuals who are experiencing crisis or mental health or substance use challenge who really just need a chance to step back, get peer support from somebody else, and kind of evaluate where they're going to go next and take care of themselves, are able to stay there and do that. And the house is staffed 24 hours a day, 7 days a week, 365 days a year with certified peer specialists, people who have walked in the shoes of the people they're talking to who are staying there, people who live well with mental illness or substance use disorder. And so we're really, really proud. It's been a very successful program over the last few years. We've had about 300 guests now, I think, and the warm line calls that we get in. The peer specialists also take calls from individuals who don't necessarily want to stay, but they want to talk. We have had, I think, over 4,000 now warm line calls. So we've been doing great work, but when you back up and think about why we're here today, what I want to tell you about Iris Place is how we got there. Because we're just a mental health organization. We're not a housing organization. We hadn't operated any kind of facility, anything close to Iris Place. So when the opportunity came and the state of Wisconsin put out a request for proposal looking for 3 different peer-run respites to operate in the state, and we were so excited because it's something we'd always dreamed of doing, we applied, we got one of these grants, and we thought, great, but how do we do it, right? Well, not alone, not in our silo, that's for sure. So we gathered an advisory board, a steering committee of people from all different parts of the community, from housing organizations, from the counties, from the healthcare, from the Appleton Police Department. And it was through all those people working together that we were able to establish the basis to get Iris Place off the ground and have a program that has become a really wonderful, functional program that is really changing lives in the Fox Valley. So while NAMI's name is on the program, it's not just NAMI's program, it's the community's program. We were just the ones to pull people together to get it up and running, which is really exciting. So I also want to talk a little bit about, I could go on for hours about specific programs NAMI offers, but instead of doing that, oh, you know what? I'm not a PowerPoint person. I apologize. Is that okay, Sam? All right. I did have a couple of slides, but they were mostly art. So I want to talk about the collaborations that we, okay, he's telling me you put my name up at least. There we go. Some of the collaborations that we do, and because our programs that we developed, that NAMI National developed, or that we developed independently, play into the collaborations that we're a part of. And so I will talk about 3 collaborations today. There are many more that we're involved in, but these are 3 that are especially big, successful, and we're really proud of them. The first is our E3 collaboration, and I see Lisa Kogan-Praska of Catalpa and Jen Parsons of Samaritan sitting in the audience. E3 is a collaboration among Catalpa, Samaritan, NAMI Fox Valley, and the Hortonville Area School District. United Way also is a silent partner through their PATH program in the E3 program. So E3 is a program that aims to create a culture of mental health and wellness throughout the entire Hortonville Area School District, from the kindergartners through the seniors in high school, through all the staff and administration, and the parents as well. And when you look at the people, the organizations that came together to make this happen, Catalpa, which provides amazing mental health care and treatment to children, and Samaritan, which also provides treatment but also has this awesome screening program where they're able to screen kids to identify kids who potentially have mental health challenges and need treatment, and NAMI, who provides education and support and outreach. None of us alone could go in and create an entire culture of mental health and wellness in this school district. But we got together to talk about it, spurred by the school district, who's very supportive of mental health. And it turns out that the whole is so much greater than the sum of the parts. So what happens with E3 is Samaritan screens every student in the entire district to see if they have any kind of mental health issue that might need to be addressed. If that student screens positive, Catalpa is there, embedded into the schools, providing the counseling, the therapy that students might need without those kids having to leave the school, without their parents having to leave work and come pick the student up. And NAMI's there holding support groups for both students and parents, providing education in the classrooms about mental health to break down stigma among students and to get them talking about mental health and get them to know what they need to do if they or a friend are suffering. And together, when we put all those three things together, and the data is showing us that we are making a huge difference in Hortonville. We are creating that culture of mental health and wellness by working together. Another collaboration that we're very proud of is another collaboration with Samaritan, which technically does not have a name yet, but we affectionately refer to as El Centro. And this is Samaritan Counseling Centers and NAMI Fox Valley's effort to create a center for Spanish language for Latino mental health. And again, it's bringing the best of what we both have to offer. But let me tell you a little bit about that, how this got started. How it got started is NAMI, the national organization, came up with an outreach program called Compartiendo Esperanza. And this was a program to go out into Spanish-speaking communities and teach a little bit about mental health and the stigma is very high in the Latino communities, try to break that down a little bit and get the conversation started. And we thought that was a great opportunity for us to bring that to the Fox Valley because we do have a very large Spanish-speaking population. So NAMI Fox Valley did that. We started going out and having these presentations in Spanish and talking to the Latino community. And then we realized, as members of the Latino community started listening and starting to say, okay, we want to talk about this, we didn't have anything to give them to go to next, right? So we realized we can't be out there offering this outreach program if we don't have follow-up resources. So we started thinking, okay, we're going to have Spanish language support groups, Spanish language education. We started to make those plans, as we're hearing feedback from the Latino community, we're developing that. And then Samaritan calls us up and says, hey, so all that outreach and education and support you're doing, you do know that's going to increase the need for Spanish language counseling, right? Oh, right. So Samaritan and NAMI started talking, and we don't have in the Fox Valley the Spanish language counselors that we need. So what can we do? How can we work together so that that service is provided for the people who engage in our outreach programs? And lo and behold, a year later, we have a joint program, a center for Latino mental health, where you can get your one-stop shop for Latino and Spanish language support groups, educational courses, and right there you can get the counseling from Samaritan's Spanish-speaking counselors, which they have now been able to recruit a new great one over the last month. So I know I'm running short on time. I'm going to skip over the third collaboration I was going to talk about, but I encourage you to please contact me, look at our website, reach out. We're really proud of our collaborations, and it really is at the heart of what we do. But I do want to say, before I wrap up, that it's not just about the formal collaborations, because those are really important, and they're very helpful, and we get concrete data from them. But, and Paula talked a little bit about this too, it's the informal networking and collaborating of ideas and knowing enough people and enough organizations that know what you do and you know what they do, that you can pick up that phone at any time. I view the other leaders of nonprofits in the Fox Valley as not just my peers, but my colleagues. These are the people that if I'm wrestling with a problem I don't know how to solve, I pick up the phone. And you know what? There's always somebody at the end. That's the pleasure of living in this community. So I encourage you, please, get out there, collaborate. If you want to collaborate with me, let me know. We're up for it. We just want to we're at the 10,000-foot level. We all have the same mission. Everybody in this room has the same mission, which is to make life better for the people of the Fox Valley community, right? So let's do it together. I'm really happy to be here. Thank you.